Welcome back to movingprofessional.com. So today I want to go over a mobility prep for breathing through the diaphragm. So first thing we got to do is just assess how we are breathing in the first place. So there's two different ways I want to look at this. First, we're just going to sit on a ball or some type of elevation where we're comfortably able to prop ourselves up on the knees with our knees substantially lower than our hips. Alright, so I'm using a medicine ball here. It's a soft medicine ball just to get me comfortable in this position. Alright, and that just allows for an easier upright torso, which will be a good standard for assessing breathing. Alright, so from here we want to just sense when the breath comes in, is there a lot of motion in the chest? Is there a lot of motion in the shoulders, upper trap region where the shoulder blades are kind of coming towards the ears? Or is there a lot of relaxed breathing that's just kind of coming from the belly here, all right? And then you want to specifically try to breathe, when you breathe in through your nose, see if you can get some motion in the belly and see how tight that is. You can get a sense that as you breathe in, if there's some tension around the diaphragm, you're going to actually feel it wrap around to the back where the diaphragm actually connects to. All right, so you want to just see how tight and stiff that is, how big the excursion of the belly can be, and then when you're breathing out, how easy is it to get that belly to kind of sink in, and what else are you feeling up in the thoracic spine, around the rib cage, up higher in the shoulder. All right, so this is a very qualitative, meaning it's like you're looking at that quality of it. It's not something that I can really speak to specific things, so I just want you to get a sense of what you feel and where you feel tension in your body as you're breathing. All right, another way to look at it is lying on the ground, all right, in a palms open position, because the palms open will just help to keep the shoulders in a more relaxed position. All right, and then you can put one hand on your belly, breathe in through the nose. When the belly swells, you want to feel, do you feel tension anywhere else up higher in the chain? Inhale, when you breathe out, just let the belly drop. Key here is now you're in a position where gravity can actually assist the belly dropping in. Alright, so your belly should be nice and relaxed. Alright, and a lot of times there's going to be a lot of tension in the belly that you have to learn to let go of. Alright, so it's a breath in. How easy is that for the belly to come up? And then on the breath out, how much guarding is there for the belly to drop in? Alright, so that's your assessment to get started. What we want to do then is as difficult as that is, we want to mobilize some of the areas that are involved that make it hard to get the diaphragm working. So actually, instead of starting right at the diaphragm, I usually want to start at the rib cage, specifically with the thoracic spine. Alright, so if we're thinking about what is all involved in breathing, we should have the belly be able to do some work independently without the rib cage being too stiff there. But if the rib cage is really stiff, a lot of times you're going to have any difficulty trying to expand through that and actually get down into the belly there. So first thing we want to do is really just try to mobilize it up into the thoracic spine, which is a direct connection to the rib cage. Alright, so we're going to start on the roller here. Alright, I'll show you from the side. Right around the bra line, or for guys, the bro line. Alright, so we're going to be right along the shoulder blades. Alright, with your thumbs down, you're going to keep your core or your midline turned on, and then what that just means is that you don't want to be in an extended position in the lumbar spine. You want to be neutral at the pelvis. Alright, start with the hands behind the head just to give your neck a little bit of support. Alright, you should be comfortable just hovering here. If you're not, then that shows you that there's a limitation in stability down lower. Alright, and it's just going to be a gentle massage for the upper back. Alright, and then we can start to do some hinge work where we drop down and up into a bridge, one level at a time, to assess what area is tightest. Alright, we can then add, if the neck feels stable enough, you can add a little bit of a reach to keep the arm in line with the rest of the body and create this little bit of length through there. Alright, either way, we're trying to really just open up the whole torso, make some room for this diaphragm so it's not so compressed. Alright, so about 2 minutes assessing and exploring that. From there, another area that's right directly attached to the rib cage, which is going to get tight, is the pectoralis region, specifically the deeper muscle, the pectoralis minor, which attaches to your ribs and then goes to your shoulder blade, and it will pull your shoulder forward, or when your shoulder is pulled forward, you'll get some tension in there. It's like kind of a chicken or the egg thing. Either way, what we can do is we can affect the tension of the musculature that does pull the shoulder forward by getting a ball right under the collarbone and right into the chest here, and then you just kind of want to search out any of the tight spots. So if we look at the left side here, I like this alpha ball from Role Model or from yogatuneup.com. It's nice and squishy and it kind of fits nicely under my collarbone here. And then what you can do is kind of turn your head away. Again, you can go into these overhead positions. You can move the arm and just feel how the ball blocks the motion, or you can just try to massage back and forth. And the other option is just to allow your body to sink into a position of tension. Alright, and you can do some breathing while the ball is right into the position, and the breathing itself becomes a contract, relax for where the pressure is of the ball. Alright, so you do that on both sides. Alright, and after each motion, retest your breathing and just see if anything's changed. You know, see if what you felt before is just a little bit different. It may be, it may not be, but you always want to be in tune with, retesting after each intervention that you do for yourself. All right. So when you breathe in, do you feel that there's some decrease in tension directly in the areas that you were working on? All right. So after the thoracic spine, in the area of the pec minor there, we actually want to look at the shoulders up a bit higher. By using a theracane, we can get at some of the areas on the top of the shoulder blade. So when you're breathing in and you're having some trouble or some compression in the diaphragm and that's not doing its job, a lot of times you're going to get breath coming from the shoulders, from the scapula, coming up towards the ear. So what we can do is we take this theracane, the knob right on top of the shoulder blade, right into the insertion point of your levator scapula, which goes up into your neck there. And you can find the spot that is tender and then just drop into it. So a couple different options here. You can, again, just breathe into it because that's what we're focusing on here. So you're going to just breathe in and purposely try to breathe in with a little bit of pressure up into the cane, and then when you breathe out, let all the air in. Purposely depress the shoulder and just let everything sink in, let the knob sink in a little bit more. You can also add some neck motion away from where the downward force is of the theracane to try to loosen this up. All right, and then if you can maneuver it, you can add a little bit of shoulder motion with neck motion to really focus on keeping that down and loosen up all the tension around there. Again, test both sides. Oftentimes I'll just have patients or clients hold pressure here, breathe a little bit, let it sink in, and then go for a walk, focusing on what your feet are doing, focusing on your posture, and for about 2 minutes, and then you can just really see how it feels after that. All right, and then again, test your breathing, test it lying down, test it seated, see if that's made any change. After working on the top of the shoulder blade there, now we're going to actually get into the diaphragm. All right, with the ball like so. All right, so first you can start on your back. This is the less aggressive version. You find the diaphragm, which is going to be fingers underneath the rib cage. Lean forward. Now you are under your rib cage, and then if you just cough, you will feel the diaphragm just push into your fingers. That's how you know where you want the ball to be. You want the ball to be right underneath that rib cage. All right, and then you can just hold some pressure here. So you got some downward pressure into the gut. Your inhale pushes the ball out of you. The exhale lets the ball sink in deeper, deeper, deeper. The goal here is to have your out breath be substantially longer than your inhale and get more and more comfortable taking longer out breaths. The out breath is not an active thing in this case, where it's more passive, where you're just allowing the ball to sink in and not blocking against it. All right, so that's the less aggressive. And that may be a good starting point for people, especially if you haven't done any type of diaphragm work where you've tried to release it. The more aggressive version, which a lot of times is more effective down the line, is actually lying on it. Again, you're getting in the same position, and then you just rest down. Let your body just sink into the ball, and the ball sink up into you.
Alright, that's on your exhale. On your inhale, just gently, don't try to do the most aggressive inhale possible, but just through your nose, you're going to just push the ball out of you gently without any type of motion happening at the chest or in the shoulders. And then again, try to make your out breath be substantially longer than your in breath, and just let that sink in. Alright, so after you do that for, rule of thumb around 2 minutes, but you can do more or less when you feel like you're making some change or you feel like you're actually relaxing into it. Especially with any diaphragm or any belly work in general, there's going to be a lot of guarding, so you may have to wait long enough until that guarding subsides before you really get any benefit out of the exercise. So if 2 minutes goes by and you really haven't felt like you've relaxed into it, you may want to go a little bit longer. But generally, you'll get this natural inhibition if you hang out on something for 90 seconds to 2 minutes. So that's why I usually give that as a rule of thumb. But you just got to figure out your own body. All right, after we do all of that work, you get back into the 2 breathing positions. See what's going on here at the belly. See how much easier it is to, 1, just hold this upright position, and 2, get some excursion of the belly going out and then coming in without other areas feel like they're blocking that motion. All right, and then you can retest it again on your back with the same idea. All right, I can tell you personally, just from doing that little bit of instruction, I feel less tension in the left side of my thoracic spine trying to take a breath in than I did. All right, and that was in, I would usually hold those exercises much longer. So this stuff does work. All right, so let me know if you have any questions. Breathing, so important. And basically, it's the lifeblood for every motion we do. See you next time.